Hey beautiful people, welcome back to my channel. My name is Kim, and if you're new, welcome. So today my pain is not so bad, and my kidney stone is not moving, so there's no pain. When it moves, I have pain. So I would rather it move and get it over with, but for today I'll take it, no pain. Okay, so today's video is going to be on low vitamin D and fibromyalgia. Okay, and it's a very important topic. It's one that's overlooked far too often. Vitamin D is like so crucial for your body. And if you don't have enough of it in your body, you're going to have problems, and it can be fatal. It can cause 16 different kinds of cancer. So prolonged low vitamin D can cause breast cancer, prostate cancer, colon cancer, pancreas cancer, and there's a lot more, but those are the most common ones. Okay, so vitamin D. And the reason why I'm bringing this up is my sister came home from a doctor appointment today, and her level was 15. Normal school of thought normal ranges from 30 to 100, okay? You know, some doctors say, and some experts say 25-ish. Some say 50 to 100 is normal. The range is all over there. I go with 30. Now, it is important that you get your vitamin D levels checked if you have fibromyalgia, because many of the symptoms are overlapping, okay? And if you can fix something so simple that's so important, but that's easy to fix, then let's get it checked. Find out our numbers. Always know your numbers. Don't listen to them and then say it's low or it's normal or it's high. Know your numbers. Okay? So, having said that, I'm going to tell you about my experience with low vitamin D that is still ongoing in my life after 5 years. I got really sick about 5 years ago. I was losing weight. I don't lose weight easy. I have an underactive thyroid, in genetics. Okay, so I was very, very, very sick. I was so weak I couldn't roll over in bed. I had bone pain beyond any measure. Okay, I started having seizures. I had hair loss. I had memory loss. I didn't half the time know who I was. It was bad. It was really bad. So I go to actually my gastroenterologist, and he had done blood tests on me. And it just so happened he ran a vitamin D level on me. Well, are you ready for this? My number was 0. 0. 0. And so he sent me right to the office next door where the endocrinologist is. That's the doctor who deals with low vitamin D because it's a hormone. Okay. And they started me on a tablet or a pill of vitamin D. And at first it was like 20,000 units a day. Nothing. It did nothing. I went back. Well, I can't say nothing because during all this time, during 2 years of time, the first 2 years, it ranged from 0 to 5. It fluctuated up and down, 0 to 5. Never went above 5. Can't go below 0. So then they decided that my body was not metabolizing pills, and that my body was not able to convert sunlight to vitamin D. Okay. So then they put me on the gel form of them, 50,000 units a day. 50,000, not 5,000, 50,000 units a day. That's how severe this was. In the meantime, I'm getting all kinds of tests. Come to find out I have osteopenia, and it's just like the number is like 0.2 away from it being osteoporosis. That was caused from it. Then it comes autoimmune diseases. Doctor says that was caused from it. My bone pain was so severe, my doctor said that's what bone cancer patients go through, that kind of pain. And during all this time, my fibromyalgia pain was out of control. Not only did I hurt all over, but my bones really hurt. But I hurt all over on top of it, Your normal fibromyalgia stuff, your joints, your muscles, your nerves, right? Add bones to that. Okay. So finally I got on it, and then it got up to 104. And they're like, whoa, 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 back down. And by this time, I'm no longer seeing an endocrinologist. I'm back at the VA. Yes, I'm a veteran. And whoa, 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 back down, back down, back down, back down. They went from 50,000 units a day to 2,000 units a day. So the next month, I got my test done again. Went from 104 to 35 that month. So now, I don't mess with the VA with my vitamin D. I buy it over the counter. I buy a natural one. There's Sundown. There's pretty decent ones, I get the gel form, and I take 10,000 units a day right now to maintain. And then when I get it checked, then I got to get it checked next time I go to the doctor. And then I may increase it or decrease it accordingly. I've taken my health care into my own hands because I have been treated by incompetent doctors that can't, do what they need to do. So, I mean, there was a long battle with the VA getting them to prescribe the 50,000 units a day. The pharmacy are in the VA system. The pharmacists are in control of what the doctors prescribe. They tell the doctors what they can prescribe, not the vice versa. And the pharmacist told me in a letter to me, I didn't need that and that I would be irresponsible and take too much. I was trusted with an M16. I was trusted with an M60 machine gun. I was trusted with an M203 grenade launcher. I was trusted with a pistol. I was trusted with millions of dollars of equipment. But I can't be trusted enough to take the proper dosage that you write on the bottle of vitamin D. Are you kidding me? So I went to my senator. Funny. 2 days later, after I go to my senator, and this is after 2 years, I had my vitamin D. And I was scared because I was afraid the VA would get so mad at me they would cut my money off. See, there's a dependency there because I need them for my paycheck, right? So, there's that. Okay, so the connection with fibromyalgia and low vitamin D, almost everybody that has fibromyalgia has some kind of deficiency. Almost everybody in the Northern Hemisphere has some kind of deficiency. Now, mind you, what's in your bloodstream is not always in your tissue. What's in your tissues, right? People, and there's reasons why people have low vitamin D. Mine were twofold. One, let's just put it out there, I'm overweight. And it's a fat-soluble vitamin. They keep calling it a vitamin. They should never have called it a vitamin. Anyways, it's fat-soluble, so it plays hide and seek in your fat. Right? So that's one. Number two, and this is the big one I have to stress to you guys. Proton pump inhibitors. What is that, you ask? Well, I have the answer for you. Protonics, What's the purple pill called? Dadgummit. Nexium. And other pills such as that. Proton pump inhibitors, meaning it stops the pumps. It turns them off from creating acid, right? Okay. This eats your vitamin D. I I was taking 4 protonics a day, which is a lot. Plus, I was taking drinking Maalox. That's how bad my acid reflux was at that time. So, if you can find a way to treat your acid, there's 2 ways you can treat your acid that's without taking pills. One, use a little baking soda and some water, swish it around, and drink it. Number 2, I've heard of a lot of people having positive results drinking apple cider vinegar with the mother. It sounds counterproductive, right? Using acid to treat acid, but apparently it works quite well. So there's that. Anyways, the symptom. Okay. Oh, I'm going to tell you. So with the fibromyalgia, low vitamin D causes the pain to go from here to here. Okay. You're having fibromyalgia pain, you need to have your vitamin D checked twice a year. It's just it. I was having mine tested every 3 to 4 weeks, and my insurance company said, we're not doing that. So I did it anyway, and, well, I just have to pay the bill because I was that sick. That was when I was going to the endocrinologist, the civilian endocrinologist. So, okay, let's see. Let's see what the symptoms of low vitamin D are, right? Hang on. Oh, come on. I'm sorry. Tiredness, muscle weakness, bone pain, weakness, or 8 signs and symptoms. Let's look at that. Let's see. I know where it's found. Here's your risk factors. Dark skin, elderly, overweight or obese, not eating much fish or dairy, living far from the equator, always using sunscreen when going out, staying indoors. That's what those are the common risk factors. They don't mention anything about the proton pump inhibitors, do they? No. Okay. Okay, number 1 is getting sick or infected often, right? I was sick all the time. Like, I had a cold or the flu, like, I would get over one and have the other. I mean, I was sick 24/7. Yeah. There's a link between low vitamin D and respiratory infections like colds, bronchitis, and pneumonia. Fatigue and tiredness. Well, fatigue's an overlap with fibromyalgia, right? So think about this. You have chronic fatigue syndrome, you have fibromyalgia, and now you have fatigue from low vitamin D. Just saying. Bone and back pain. Depression. We already suffer from depression. It gets much worse when your vitamin D is very low. Much worse. Like, there were days when I was suicidal. That's how bad it got for me. But when I'm telling you, it was between 0 and 5 for 2 years. You can understand how low that is, right? Anxiety was another one. Oh, impaired wound healings. Like, if I were to scrape my arm or something, normally Next day you get a scab and you're done. A few days later, whatever starts to fall off. No, it took a lot longer for them to start to heal. Bone loss, right? And you get the bone density scan done for that. Hair loss. Mine was coming out in chunks. Muscle pain. This says the causes of muscle pain are often difficult to pinpoint. You think when there's so many illnesses that have that as their hallmark, right? So when you're suffering from fibromyalgia, then you get this. Your muscles really ache all the time, and the restless leg syndrome is just horrible. And then you got the bone pain and the joint pain and the nerve pain. And the migraines. Oh, Lord. So it is very important that you get yourselves checked. Almost every doctor appointment you go to. Some people only go to the doctor once a year, twice a year. Oh yeah, like if you start popping up with autoimmune diseases, you better get checked. If you're already low, you've got to eat natural foods that are rich in vitamin D for one. And number two, I don't you have to get you a good vitamin. Go to a vitamin store or order one online. Don't get it from Walmart or Kroger's or Myers or Piggly Wiggly or wherever. You want something that's fresh. You want something that that doesn't have a bunch of additives in it. So, and I see it wouldn't even matter if I went to a tanning bed because, like, I'll be out. Some of my lowest vitamin D levels are when I'm out in the sun all day long. I'll get sunburnt. I mean, you see how fair my skin is. But, so my body does not metabolize it. And then it does not metabolize the tablets. I would get it in gel form. Do not get the tablets. Because, like, if you have IBS and you've got diarrhea, it might just flush out your system. That might have been part of my problem. I don't know. But I don't care to know anymore. I just know that the gel ones work for me. And thank God I didn't have to go to injections because those are hella expensive. But that's where I was on my way to. So, actually, I was on my way to a coffin. So, and I don't know what the long-term effects for me are going to be like because it was so low for so long. I don't know, I am at a higher risk for getting MS because of the low vitamin D. I'm at a higher risk of getting these cancers because of, except for prostate. Of course, I don't have one of those, right? But I'm at a higher risk for those cancers because of the low vitamin D. So, get tested and know your numbers. What is it? Have you been tested lately? What are your numbers? Should always know your numbers to everything that you get tested. You just should. Because then you can be your own best detective and advocate, right? If they say it's low, say 30 is normal and they're saying it's low, is it 29 or is it 5? Right? Or is it 20? 20 is a long way from 25, even. 5 points makes a big difference when it's that low. So, okay, I'm going to leave you with all that. I'm sorry, it's long. I know, I'm long-winded. I just needed to get this out because this is so important. Okay, Now for the business end. Please subscribe to my channel if you haven't already. And listen, some of you have subscribed, but because your things are on marked private, and I don't see, when I go into my subscriber list, I don't see them. It's going to be kind of hard for the giveaway if I can't see who you are. So unmark the private if you want to be part of the giveaway, okay? And so please subscribe to my channel. Ring that bell, ding, 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 ding. And like this video, give me thumbs up, smash that button if you like the content, and leave me a comment. Tell me how you're doing. That's what I really want to know. How are you? Are you okay? Anyways, stay well, my friends. Until next time, bye.